Hello, I'm Rosalie Michaels, and welcome to the Pain Channel. Chronic pelvic pain. 1 in 7 women has it, and most women will experience some level of pelvic pain in their lifetime, and men may also experience it. Pelvic pain can be a symptom of numerous different disorders and often cannot be isolated in treatment. So what can be done about it? For answers, we turn to the director of the Pain Center of Arizona. Thank you for joining us again, Dr. Sywick.
Hi, Rosalie. It's great to be back.
So, Dr. Sywick, can you tell us more about pelvic pain?
Well, chronic pelvic pain refers to pain that's in the pelvic region. And more simply put, this pelvic region is the area that's located between the belly button and both of the hips. I would say that most of the symptoms in an issue of chronic are referring to that type of pain that's been going on at least 6 months or more. And to be even more specific, the symptoms are often described anywhere from a dull, aching discomfort to sometimes sharp and cramping. Patients will have anything from a constant type of pain to pain that comes and goes, is more intermittent, and sometimes it's associated with the menstrual cycle and sometimes it's not.
Wait, so what are the most likely diagnoses of pelvic pain?
Well, there certainly are several causes and several diagnoses that are often related to the issue of chronic pelvic pain or put under the label of chronic pelvic pain. Endometriosis is one of the more common. This is simply a condition where tissue from the uterine lining is found outside the uterus. These tissue deposits respond to the menstrual cycle similar to the uterus itself. That deposit of blood then is trapped within the abdomen and forms at sometimes issues of scar tissue and fibroids. Another common condition is pelvic floor tension myalgia. This is an issue where the pelvic floor and all the musculature of the pelvic floor is responding in this spasm type of way that produces significant amount of pain throughout the pelvic area. Yet another diagnosis under the label of chronic pelvic pain is a painful condition known as interstitial cystitis. And this, simply put, is a chronic, painful inflammation of the bladder. These patients experience a very painful condition that is associated again with frequent urination, and sometimes with that urination the pain gets a little bit better, and sometimes and often it does not. As the bladder fills up, often that pain significantly returns. It's important to emphasize the issue that a multidisciplinary approach really is crucial to the success. Or let me say it another way. Oftentimes when I'll see a patient for the first time, they really have already been to several different types of specialists or several different types of surgeons that there's been this discoordination of care. No one has really put the entire evaluation and diagnosis and plan for treatment in a unified approach. So the team approach is crucial. And in that regard, again, there's often a pain management specialist and sometimes a behavioral pain psychologist or some level of counseling and a gynecologic surgeon. It just so happens in this case we have one of the best in the country. And I'd like to introduce now Dr. Michael Hibner. And Dr. Hibner's specialty is specifically advanced gynecologic surgery. So we're going to be asking Dr. Hibner about his thoughts on chronic pelvic pain and his specific advanced surgical approach to patients with the disorder.
The majority of patients that have pelvic pain of whatever reason also develop spasm of the pelvic floor muscles. It is probably one of the most common reasons for women to have pelvic pain. It may coexist with other conditions such as endometriosis, interstitial cystitis, or it may be just a pelvic floor muscles pain by itself. Botox is a medication that paralyzes muscles, and we have found in our practice that it's extremely helpful. We have just presented a study at International Pelvic Pain Society conference in Chicago just last week on approximately 200 patients, and we have shown that 67% of patients with chronic pelvic pain, their pain goes away after Botox injection. Well, again, just like with Botox, because one of the most common reasons for women to have chronic pelvic pain is pelvic floor muscle spasm, physical therapy is used either alone or with conjunction with Botox to relax the muscles and improve pain. Well, my advice to a patient is if you don't get a diagnosis from your primary care doctor, your gynecologist, your urologist, or whoever is a doctor that is trying to diagnose you with your condition, then you need to find a pelvic pain center. And there are several of them across the country, and try to get that diagnosis and treatment. I have seen hundreds and hundreds of patients with chronic pelvic pain. I have never seen a patient that is in their head. No one is crazy. Of course, patients that have chronic pelvic pain have high anxiety, they have depression, because anyone with chronic pain would. But they don't have pain because they're crazy, and I still hear from so many patients that they were told they were crazy, it's all in their head, and it's not all in their head. So find help, go on the International Pelvic Pain Society website, which is pelvicpain.org, and on that website you can find specialists that truly specialize in pelvic pain, and find one of those specialists in your area and see that person.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
To keep you updated and informed on the latest news, studies, and treatment options for pelvic pain, we've been scanning the news wires. And here are a few reports on pelvic pain pulled from the day's headlines. If you have interstitial cystitis, it might be a good time to find Mr. Right. A study of 96 women with the painful bladder disease found that solid spousal support was effective in distracting the women from their pain. Those women whose husbands often read to them or talk to them about their day reported a greater sense of well-being and comfort than those whose husbands reacted negatively to their pain. The lesson, as always, is that it usually really is his fault. A study in Italy found that hormone therapy may effectively reduce the size of endometriotic nodules. The study, in an effort to find means of reducing pain for endometriosis sufferers, found that over 1/3 of the women had their nodules reduced by over 25%. Nearly 80% of the women tested saw at least some reduction. And lastly, we have more good news from the endometriosis front. Top Chef alum Nikki Cascone is pregnant. The reality television star, who was diagnosed with endometriosis several years ago, is opening up to the media about her fight with endometriosis to promote awareness about the disease. It took nearly 2 years to diagnose the disease, but once it was discovered, she opted for a laparoscopy. Doctors were able to save her right ovary, and she is now expecting her first child in January. And now it's time for the Pain Channel's running feature, Ask Dr. Sywick. It's free medical advice, people. What more could you ask for given the current healthcare system, right? This week's question comes from Lynn Claiborne of Palo Alto, California. Lynn writes, Dr. Sywick, love the show. Thanks, Lynn. I've been having horrible pelvic pain for the past 6 months, and I've tried almost everything. What can I do to avoid a hysterectomy?
Wow, well, thanks for your question, Lynn. And I would tell you, certainly if you're at the point of decision-making for a hysterectomy, then this is obviously a debilitating type of pain that you've had for a while. One of the most important things that you need to be sure of is that you have a team with the right approach. That approach really should have already focused on evaluation and diagnosis, and as best as possible, really try to pinpoint the cause for you in that issue of chronic pelvic pain. Once that's happened, to assure again that some of the more simple and conservative therapies have failed, that being again medications, sometimes physical therapy, sometimes simple injections, and then surgery being when some of those conservative options have failed. hysterectomy certainly is an option that can alleviate some types of chronic pelvic pain. It's typically those types of pelvic pain that are associated with uterine disorders or disorders of the uterus, commonly fibroids, for instance. Not all patients, however, that have hysterectomy will have a relief of that chronic pelvic pain. And this is often in patients that are in younger ages, less than 30. It's shown that sometimes hysterectomy is not the option to relieve that pain. And then, of course, if it is a young patient that hasn't had a family yet, hysterectomy is a significant decision before moving forward. I would encourage you, Lynn, to make sure you've got the right team. Again, contact us at the Pain Center of Arizona. We've got a team in place, and you've heard from Dr. Michael Hibner today. We work with him quite a bit, and so we have a comprehensive approach for you. And good luck to you, and thanks again for watching, and thanks for your question.
Well, that's the show for today. Be sure to join us next week for another exciting episode. And don't forget, if you have a question for Dr. Sywick, you can email him on our website at painchannel.tv. We'd like to thank everyone who contributed to this week's show. I'm Rosalie Michaels, and I'll see you next Wednesday at 3 p.m. on the Pain Channel.